and I'll get a notification on my phone in a moment. You might get that notification as well.
Yeah, got it.
Awesome. Looks like we're live within the group. This is Chris Porton here with Dr. Casey Jones of holistic dentist out of Wilmington, North Carolina. I actually met with Dr. Casey Jones in person about a couple weeks ago or so. We live locally, and Dr. Casey Jones is here to talk about oral health, of course, as a dentist. Most importantly, how it affects overall health and well-being, overall aspects from the immune system, from gut health. And what she really specializes in is sleep, how it affects the breathing, in addition to breathing and so forth. So feel free to introduce yourself. So happy to have you here.
Thank you. I'm so happy to be here. And so I'll try to do a short introduction. As I get older, my story gets longer. So I'll try to just bring in the highlights here. But essentially, I have been a dentist for the last 12 years. Prior to being a dentist, I was a professional dancer. And I met my husband on a national tour of My Fair Lady, but I've always loved science. I even did research on sleep apnea back in college. So when I decided I wanted to go back into science, I thought I was going to do research on sleep apnea. And so I tried it, and I was in front of a computer all day, and I hated it because there was no people interaction. So I was like, well, that's not it. And then my mom suggested dentistry, and it was both artistic and scientific at the same time. And I've always been a little obsessed with my teeth. I got the toothbrush award going down the hallway in college. And so I explored it, and I ended up going into dentistry, which I love. I never thought that the two would intersect. So I've always believed that oral health is part of your overall health and your mental wellness. I've considered it my superpower, that I've been able to give people their smiles back. But lately, I think it's breath that connects it all. It's so important. Breathing and sleep were never meant to compete. So many more people are breathing dysfunctionally than we realize, and we can see the signs and symptoms of it just by looking in their mouth as a dentist. So it's driven me to create Sleep Wellness Wilmington and to share this message and to dive even deeper into it. And so I'm excited to be here today. And I should say, labels are weird, because I was talking about this today, and I wouldn't call myself a holistic dentist. I would call myself an oral, that's okay. I would call myself an oral health physician, or I would say maybe a whole person or a whole body, total health sort of dentist. It's all connected, and it's never one thing. So.
Absolutely. It's so important to recognize that, as I had quite an extensive meeting with you, and we kind of talked about how everything relates from cardiac health, from digestive health, from brain health. And actually a couple of weeks ago, actually last week, Lindsay McCormick spoke about the connection between brain health and oral health. And I think she shared a story of one of her patients, who they found oral plaque in like their joints and other parts of their body, where it's like, whoa, we didn't really expect this. But though that plaque can actually move to different parts of the body, like we're saying, from our heart, from our brain, and so forth. And there are ways to support it, but it's really important from the beginning of our lives and all throughout our lives to do our best to prevent it. Because we don't want to get to that point where we're finding plaque in all kinds of areas of our bodies, because that can have an issue. You wouldn't expect to have like oral plaque that was come from our mouth, in our joints, and our bones, and so forth. So it really is all connected, and it's so good to see you here.
Thanks. Well, I think speaking to that, most people still don't even realize that gum disease and cavities are actually bacterial processes. So they're caused by a certain type of bacteria, right? But we have good bacteria and bad bacteria. So we want to keep that in balance. We don't want to kill all the bacteria, because it's all connected to the gut, starts here. And so if we are constantly rinsing with Listerine, for example, that alcohol can kill the good and the bad stuff, dry out the mouth, get things off whack. And so, it's sort of figuring out how to get things healthy. And when you're speaking of the bacteria that's actually going to other parts of our body, when we have inflammation in our gums, and the first sign of that is bleeding, that inflammation from our gums, those bacteria can go into our system and go to tons of other places throughout our body.
So. Absolutely. So important to recognize how it's not just a one system, the whole system affects other systems, like Brittany and I have spoken about in the past. So it's really important to recognize that though you support one area, and you're also going to pay multiple dividends and support other aspects as well. So as well from the brain health, and we're going to do our best to support our bodies now with proper oral care, dental care. What are the basics you recommend to your patients? Obviously, cleanings a couple times a year, flossing, brushing your teeth and so forth. What are the basics you recommend as far as breathing, oral care, and so forth?
Sure. So there's no science actually behind the seeing your dentist twice a year. It's really dependent on your needs. So some people will need to see their dentist at three or four times a year to help us disrupt that bad bacteria that's causing the destruction in their mouth and the loss of bone around their teeth as periodontal or gum disease. So it's kind of varied and dependent on what you need specifically as far as your going to see your dentist for your hopefully wellness visits and keeping you healthy and all of that. But at home, definitely I do recommend brushing twice a day, flossing once a day. I always explain when you're brushing, you want to brush where the pink joins the white, because so many people will brush the teeth and they often do this, but then you miss right where the pink joins the white, and that's where all that bacteria collects. And then the toothbrush bristles can't reach in between the teeth. And so we need something to mechanically remove that as well. And that's the floss. You can think of your gums kind of like your fingernail. There's a space between your gums and your fingernail, just like there is, your gums and your tooth, just like there is between your finger and your fingernail. And we want to clean that space out with the floss too. So I recommend that. I also recommend a healthy diet. So people don't realize that bacteria likes to eat the same sugars that we do, and there's so many hidden sugars in our Western diet, and the sticky stuff that sort of stays in our teeth and in the grooves of it is going to be more likely to cause cavities. So yes, candy and stuff like that, but also goldfish crackers that get stuck in the grooves of the teeth are one of the biggest culprits in kids that we see so much decay happening. So making sure that if you are choosing to have snacks like that, that you follow it up with a piece of cheese or some carrots or some apples. I tell kids to do the Oreo challenge, where they eat an Oreo, open their mouth and look and see all that black stuff in there, and then take a piece of cheese or something or carrot, and they'll see it clear out of there. So it's kind of a fun trick for them to do. But importantly as well, we want to make sure that we're breathing through our nose instead of our mouth, because if we're breathing through our mouth, we're going to have more of a dry mouth. Sometimes, depending on when we started breathing through our mouth, it can actually affect how our jaws grow. We're already growing smaller jaws, but with our softer diets and with us chronically having open mouth posture, we're starting to grow longer, more narrow faces, and for our airways to grow down and back. And so it's making it harder for us to breathe. So correct posture. So I say, like you're going to click it, tongue up, lips together, teeth apart, and breathe through your nose. So tongue up, lips together, teeth apart, breathe through your nose. Because even if you're only breathing through your mouth at night, that's a third of your life. And it can really change your overall health, but also your oral health. So that's a whole big conversation that we can get into if you want.
That's so important. And it's cool to recognize the importance of it and how it affects, like you mentioned, dry mouth and so forth and so forth. And again, we just mentioned gum health is going to affect our bones, our joints, our digestive system, brain health, and everything else, obviously. Are there ways to, and like you said too, change the effect of your mouth? So if someone has been breathing through their mouth for say 5, 10, 15 years, it's now just involuntary. They just do it. They don't really think about it.
Yeah.
Is there a hope? Is there hope?
There is absolutely hope. That's my thing. Good. I think there is always hope. So if it's become a habit to breathe through your mouth, you have to relearn, right? And that's why it's part of what I do. I do myofunctional therapy and also breath retraining. So it's kind of like physical therapy for the muscles of the face and jaw and mouth and airway. And also just learning that correct tongue posture, breathing through your nose, because it's not automatic. We can fix the structure. We can remove tonsils, adenoids. We can fix the turbinates by turbinate reduction. It's not me, but somebody could. We can grow the airway, expand the palate, all sorts of things, reposition the teeth. But if we don't fix the habit that was the root cause of this and have them breathing through their nose, then those things can come back. Tonsils can grow back. We can see nasal issues continue. So you need to be educated on how to breathe through your nose and replace the habit. Mm-hmm.
That's so important. And I use the analogy with Brittany when it comes to inflammation. And we can take an anti-inflammatory supplement or foods, but if we're still putting inflammatory foods in our body, it's like driving, but with your with the one foot on the accelerator, the other foot on your brake. You're not going anywhere, or you're adding fuel to the fire in a sense. So you're like doing one thing, but you're not really making any progress in that. So it's important to make sure everything is, I guess, working in synergy with one another, obviously.
Yeah. And for so many people, there are some people where there's some sort of obstruction or something that is preventing them from being able to breathe through their nose. But a good test is that if you can close your mouth and comfortably breathe through your nose for a minute, you can breathe through your nose for life. And so there are ways to help break that habit. There's things like myotape. I was looking around to see if I had any sitting here, but even just taping your mouth during the day, it goes around your mouth instead of across it. And so that just reminds the lips to stay closed to help replace the habit when you're not thinking about it. If you're watching TV or something, you're awake, you can still open your mouth, but the elasticity reminds you to keep that mouth closed and breathe through your nose.
And it can be less intimidating too. It's like, are you like, what are you trying to do to me if you tape my mouth shut? But if you just have the piece around your mouth, it's still cool. It's still good. It's not as intimidating in a sense. I know you wouldn't do that, but just from the perspective of you stop me from breathing, so it's can work out well from my perspective, obviously.
Absolutely. So if someone had tape across their mouth this way, or even for some that do it this way, it can be very scary to them not to be able, but again, if it's just going around, or sometimes you can even just put tape here to remind the jaw to stay closed. There's different ways to do it. And it's not for everybody, but especially trying it during the day to see if you can get used to using that nose. Because interestingly enough, there's such thing as nasal disuse. So if you don't use your nose, it actually becomes harder to breathe through your nose. So breathing through your nose promotes nasal breathing because we produce the nitric oxide that helps to open up the airway and disinfect the air. There's so many cool functions that our nose does to filter the air and get it ready to enter into our lungs. But we don't get any of those if we breathe through our mouth. The dirty air just comes through, and our tonsils do the best they can to filter it, but they work overtime and they get bigger. And then that makes it even harder to breathe because now they're blocking your airway.
Interesting. It all works together. And can you kind of work your way up like 5 minutes at a time through your nose and kind of tier it in a sense, so you're not just going from like 0 to 30 when it comes to.
Yeah, everyone has to start somewhere. And sometimes, so there's so many breathing exercises that can be done. And for someone, we could even try one now for someone who is stuffy. A good way to sort of establish is this stuffiness that's from congestion and can clear, or is this an obstruction, is to do the nasal clearing exercise, which is in both the Oxygen Advantage and Buteyko Clinic breathing methods. Kids can do it, adults can do it. Essentially, you take a normal breath in through your nose and a normal breath out. I'll explain it first. And then you pinch your nose and you'll gently nod your head up and down, or you can go side to side. It's really just a distractor or sway, whatever you want to do, until you feel like you have to take a breath. And then when you have to take a breath, you're going to keep your mouth closed, you're going to let go of your nose, and you're going to breathe through your nose. And a lot of times when you do that, that nitric oxide will have pooled, and when you breathe it in, it helps to open things up. So we can give it a try if you want to.
I just saw a comment in this. Some of this nasal breathing issues are from allergies and constant sinusitis. Can you speak to that?
Yeah, for sure. So yes, absolutely. If there are chronic allergies, then we want to address that. So that might be a referral to an allergist. That might be figuring out what they're allergic to. I had allergy shots as a child. Changed
Okay.
my life. I was allergic to a lot. I do not
Right.
take any allergy medications anymore. The other thing that sometimes works for people is Xclear nasal spray. So it's xylitol that's in it, which is a natural sugar. We use it
Right.
to fight cavities also, but it fights the virus that causes flu, COVID. It helps to moisturize the nose, and it's all natural. So you can get it on Amazon, but Xlear or Xlear, you use
Cool.
that, and that can help with that too. The chronic sinusitis, it depends on what's happening. So sometimes there's no true reason for it, and sometimes it's simply from the habit of breathing through the nose, that the nose
Okay.
is stuffy because it's the nasal disuse. You're not using
Right.
it. So it's
Okay.
almost like your body forgets how to use it.
Absolutely. It's like I said, it's good news is it's possible to switch gears from mouth breathing to nose breathing and so forth. It's some people like myself, I'll admit it, because like you met with me, obviously, we're chronic mouth breathers. Again, I don't know if it's environmental, my body just got used to it. But the good news is that it's possible to switch gears from mouth breathing to nose breathing. And there are steps in the process which you can take to be more effective about it. And which is also going to benefit the mouth, obviously, less mouth dryness and so forth. So that's important. I'm glad you touched on the sinusitis.
Yeah. So, but even more than the oral health piece of things, when we are
Right.
breathing through our mouth all the time, it's causing inflammation throughout our body because we're not
Okay.
filtering the air in the way that we should. And especially if that is something that's carrying over into our sleep and we're struggling to breathe while we're sleeping, that breathing and sleep are never meant to compete. And if they
Right.
if they have to, we hope that breathing will win every time, because then you're live.
Of
But
course.
if it's at the expense of quality sleep, it can be like an explosion of inflammation that affects every system of the body negatively. So we see type 2 diabetes, we see strokes associated with it, we see high blood pressure, I see thyroid issues a lot of times. There's a lot of inflammation, more chronic pain. We see people suffering from anxiety and depression because they're not getting that restful sleep to make them feel more resilient. And sometimes that chest breathing that happens when we're mouth breathing. So if you take a breath through your mouth and notice, you're going to feel it come in through your chest. But if it's up in your chest, our gas exchange doesn't even occur until it gets down into lower areas here. So if our air is only being exchanged up here in the top, it's very inefficient, and we're breathing a ton of air, but we're not actually getting the opportunity to use it in the way that we would hope to. So if you switch to nasal breathing, that actually promotes diaphragm breathing, which is our breathing muscle attaching down here. And so as that I like to think of a jellyfish as you breathe in and out, and that can trigger our vagus nerve, make us feel more calm, put us in that rest and digest mode instead of that constant fight or flight sympathetic mode that so many of us are living in this crazy world.
I was just going to mention that about a fight or flight, rest and digest, sympathetic, parasympathetic. It's like I said, that can almost become our default state, which is not a good place to be in. We do not want to live there, obviously. So whether it's from stress that's causing it, or is the stress causing that, or is your breathing causing the stress? Because it does the chicken and the egg come first.
Yeah,
exactly. It's hard to say specifically, but it does. One impacts the other, and vice versa, obviously. So you were mentioning a simple exercise we can try to do on the spot, in a sense.
Yeah. So there's one, I love doing the breath recovery one. So it's just very small breath holds. So anytime in the methods that I teach for functional breathing that are based on the Oxygen Advantage and Buteyko clinic methods are to hold your breath after the exhale. So essentially you would take a normal breath in and out, hold your breath, and we'll do it for just 3 seconds. You can do it for 3 to 5 seconds. And you hold your breath, and then you start to breathe normally again for about 10 to 15 seconds, and then you're going to repeat it. And so I'll pull up my stopwatch here and guide you guys through it.
Cool.
So this is one that you can just, sometimes if you are encountered with a stressful situation and you just start to feel things get a little well, whatever it is, if you're about to go on Facebook Live or whatever, you can do this to reset yourself and bring some calmness so that we can't choose what happens to us, but we can choose how we react to it. And if you're able to control your breathing, then sometimes you can react to that situation differently. So
Absolutely.
Go ahead and take a normal breath in, normal breath out. You can either pinch your nose or just hold it for 3, 2, 1. You're going to let go. And you're just going to breathe normally, even if that's through your mouth. You don't have to do anything to alter it. And you're just going to continue breathing. And then you're going to get ready to do it again. So you're going to take a normal breath in, normal breath out, pinch your nose, and hold it for 3, 2, 1. Let go, breathe normally. See if you can start to notice the slightly colder air as it enters your nose and the slightly warmer air as it leaves your nose. You're going to get ready to do it again. So you take a normal breath in, a normal breath out, and you're going to hold it for 3, 2, 1. You're going to continue to breathe normally and comfortably, preferably through your nose. But if you're not there yet, that's okay. We all have to start somewhere, and there's hope.
Absolutely. The most important part is there's hope. Always keep hope.
Absolutely. So you're going to try it again. Normal breath in, normal breath out. Hold your breath for 3, 2, 1, and continue breathing normally. And you're going to get ready to do it again. You're going to take a normal breath in, a normal breath out, and you're going to hold it for 3, 2, 1, and you're going to continue to breathe normally. And the thing with most of these exercises that I teach is that you can truly do them without anyone ever knowing that you're doing them. So if you're choosing not to hold your nose, because you certainly can hold your breath without holding your nose, you can do this. I do this while I'm working in the middle of a procedure sometimes. It's just something that you can quickly use to help calm everything, especially in the dental environment. There's so much dental anxiety, there's fear, and sometimes that fear that you're absorbing from other patients can start to affect you and your staff as well. And you want to have a calming, inviting, fun, helpful environment for them. And so just checking in on your breathing can help do that too. So that was just a real short snippet of it, but
that was really good. And I met with you in person. Anyone that's in the Southeast or North Carolina area, feel free to visit Dr. Casey. She has a wonderful and very welcoming demeanor, as you can tell. But it's very important from that perspective. You go into a professional like you, that's very comforting, and that's going to be easy to work with. Because as you said, it can be intimidating, like kind of scary, like someone's picking on you in your mouth's open, you're vulnerable, and so forth. So it's an interesting environment, but you do make it very welcoming from that perspective. Wow. And working with a professional like you, it was in a good way, but it was a lot. You had me walk down the hallway to measure my breathing, see how I was breathing, whether I was able to walk and talk and breathe at the same time, whether that was in tune. Like, how does that all come together? Like, what's the purpose of that in a sense?
Well, so it's interesting because I always say it's all connected. It's never one thing. And that's why I love also collaborating with other physicians, wellness providers, physical therapists, dentists, orthodontics. So sometimes our body posture can literally change from how we're breathing. We can change in order to compensate and be able to breathe. And so the simplest way to describe that would be that if someone is struggling to breathe, they will often lift their chin up in order to be able to breathe, almost like you're doing CPR, but then you can't see. So then you have to bring your head forward down to see, but then all of a sudden you've got this head forward posture, which starts to trickle down because now you're imagine holding a bowling ball forward like this, right, versus, stacking all the bones on top. So there can be, hips that are out of place, things that are out of whack that also affect the jaw and the bite, and it's all connected. So, sometimes in how we hold ourselves when we're walking, can you exercise with your mouth closed? Because ideally, we want to be exercising even most of the time with our mouth closed, because that's going to be more efficient breathing as well. You're filtering that air, you're going to get it to the places where it needs to go. You're going to have less muscle soreness and, fatigue less. Now, certainly, if you're getting to the high speed and you have to open up that mouth, this hole is bigger than these holes. So there are times when people will have to make that switch. But there's ways that you can train your breathing even for to increase your efficiency with your athletic performance. And that's what the oxygen advantage piece of the breath retraining really is. And that's exciting as well. Because not everybody that's breathing dysfunctionally, which I was, where, it's not even necessarily that you're always breathing through your mouth. Sometimes it's just that you're breathing more rapidly, shallow. I recently even learned that the diaphragm is connected to our pelvic floor. They work together and they're parallel. And if you have, if your hips are tilted back and they're not in line, then it affects your breathing. So your posture, again, can affect your breathing. And this is all very new information to me and is fascinating. And so, always something new to learn, but it's all connected. I certainly am not one that is doing the physical therapy part of things and everything, but as you're walking, sometimes doing those breath holds and getting used to that, or even just getting used to walking with your mouth closed, can help with things as well.
It's interesting you mentioned the diaphragm connecting to your pelvic floor. Mm-hmm. As you know, anyone who follows my Facebook knows I'm a big music buff. I have a inner rock star to me. That's part of who I am, but it's also besides the point. But I was listening to an interview with a rock singer who has a very high operatic voice, a very wide range, and he was talking to a singing a woman who's she's a voice coach, and they're talking about how, kind of jokingly, like, there is a connection between your pelvic floor and like holding your pee and, holding yourself and your voice, and how it goes from like here to your 3 feet or whatever below, whatever it is. And like, it's kind of just goes back to what you just mentioned from a voice perspective, from a vocal perspective, because you have to hold your notes and sing and so forth on stage, and how it all really works together.
Yeah, absolutely. And even beyond that too, it was actually, so because I love collaborating and I get inspiration from other people, I created this group of a wellness collaboration. And when that started, it was just a few of us, and it was some myofunctional therapists,
right.
Just a group of people. And I said, who else needs to come to the table? And one of the myofunctional therapists said, I think we need a pelvic floor specialist. And I was like, okay, cool. I think I might know one, but explain to me why you're thinking that. And so she was talking about how it's connected also to tongue ties, which is a whole nother topic. So there's an attachment under our tongue. And so if that attachment is really tight, then it can affect, even from the time when we're really young, whether we're able to nurse, how we're able to form our speech and how we sound, how our jaws develop, because if our tongue literally can't get up into that position that I love, with the tongue up, lips together, teeth apart, breathe through your nose. So if it can't get up to the roof of our mouth, then we're going to form smaller jaws up there. And our jaw up here, our roof of our mouth, is the floor of our nose. And so if you don't have your tongue up there and the only thing pulling on it are your cheeks, you're going to get a much more narrow V-shaped arch instead of that U-shaped arch, which that's dental speak. But essentially it's going to mean that your nose is smaller. So it's going to be harder to breathe because you develop this smaller nose. So that's what happens with the tongue tie when you're younger. And now we know more about this and we can catch it more. But when you're older, you may have formed compensations in order to function with it, but it can still affect things like causing neck and back pain because there's this tightness, and it still can affect, sometimes how you're able to chew your food. So then how you're able to digest. The pelvic floor can go hand in hand with, having constipation or abdominal pain. And so it's really interesting to get to see, now that I know more, how it's really all connected, and be able to be kind of like the quarterback that gets people to where they
you
need to go.
You don't really think about it. Like, we don't really think about, oh, like one thing is connected to the other. You just think of it as one body system. Or you go to a cardiologist for your heart. Of course you do, just without a doubt. Go to a dentist for your teeth. Of course you do. But it all works together. So you support this. You're also going to support your gut, because your gut's going to be healthier. You support your gut, your teeth are going to be healthier. And I think I mentioned to you, I heard a story of, again, I can't make any claims, but there was a woman who had some pretty bad gum issues, and she was able to, again, support it to better well-being health, in a sense, by using digestive enzymes and a couple of other, I think, coconut oil and a couple other things. You wouldn't really think about that off the top of your tongue or your brain. You're like, oh, why would I need this for that? But there are studies showing that. So it is all connected.
It is. Yeah. I even had a younger kiddo, sort of teenager, come in, and she had beautiful oral hygiene. She's taking great care of her teeth, but she's still getting decay, and her gums are kind of swollen. And, you know, I said, well, you know, honey, are you on any medications? And she said, I'm not right now. And I said, explain that answer to me. She said,
what does that mean?
Yeah, she said, well, they keep trying all these medications because I'm having all these stomach issues, and I'm throwing up, and I'm this and I'm that, and they can't find anything that works. And so that's part of the problem, the acidity. But I said, well, okay. And I could see some other signs that she was probably mouth breathing. So I said, well, do you breathe through your mouth or through your nose? And she said, well, I breathe through my mouth because I can't breathe through my nose. It's the same thing as my mom. We've got allergies. And so I said, well, okay, but your bacteria is all out of whack. You've got like this good bacteria that's been killed off, because she was rinsing with Listerine every time that she did vomit. If she couldn't brush her teeth, I said, okay, stop that. Rinse with some baking soda and water just to balance out the acidity. And, you know, just talked about, maybe you want to try, you can breathe through your nose. You know, I had watched her do it, and I said, maybe you just want to try closing your mouth and breathing through your nose, and that could affect this and this, and explained it a little. And at the end, she was like, you're the first person that's ever told me to breathe through my nose. And, you know, it's such a simple thing that you can do. You can switch on your own. There's no cost to switching the habit just to going to nasal breathing. It can affect a lot of things. I've seen people have chronic headaches, switch to breathing through their nose instead of their mouth, and the headaches go away. You know, it's not going to fix everything. It's not always all about breathing, but breathing through your nose is pretty amazing. I can't say that.
It's going to pay many dividends for overall well-being, from immune health, from emotional health and well-being, from being centered in a sense, obviously. So it's going to really support everything. So there's no downside by any means, but it's going to support so much.
Yeah. And then with the breathing, you know, the functional sort of breathing that I promote, it's really just learning to breathe lightly. So a lot of people are actually breathing more air than they need to. So it's learning to not make any sound when you're breathing. Sometimes it's breathing less air than they ever have before, because simply closing your mouth and breathing through your nose, you're going to be breathing less air because these holes are smaller. So breathing lightly, breathing slowly. So again, if you're breathing through your mouth, a lot of times we're breathing really rapidly, and that can bring that sort of anxiety. It's almost like hyperventilating, right? And so many people are chronically hyperventilating, and it's bringing more anxiety to them. So breathing lightly, breathing slowly, and then breathing deeply, which is different from a big breath, because a lot of times people will say, like, take a deep breath. And instead of taking a deep breath, they'll go, you know, which is not what we're talking about. You want to be breathing from your diaphragm and just get that air down to where you want it to go. And there's cadence that you can do for breathing to breathe that to a certain pace and stuff when you practice. So much there's always more, right? Always more. Yeah.
And again, whether we're sitting in traffic and someone cuts us off or whatever's going on, we can always go back to the breath, like you mentioned. It's something that's always there. We're always doing it.
For sure.
We'll always access that to bring us center and calm and so forth. So it's really beneficial. So it's always available in a sense.
Mm-hmm.
So
go ahead.
What were you saying?
I was going to say it's so exciting as well, because it's something that I think a blessing out of the pandemic has been that we can do stuff like this. We can do Zoom,
Right.
we can connect with people much more easily than we ever had maybe thought of before. And so with breathing, that is something that you can do the re-education, the retraining virtually as well. So you can help someone with their breathing in this sort of capacity, or even in group sessions and stuff. So I love to do that with people too.
Great. I apologize, not to you, but I apologize to a member in the group. About 10, 15 minutes ago, she asked, do these techniques help when sick?
They can. So they're meant more for like when you're, this is the way that you want to breathe at all times, but absolutely.
Okay,
When
cool.
you're stuffy, you can do the same sort of exercises, breathing through your nose. You absolutely can. But, if you have a cold and you can't breathe through your nose, that's not the time to tape your mouth shut. You got to breathe, you got to get your mouth open, all that sort of stuff. So yes, you can certainly do the nose clearing exercise when you're sick. You can breathe through your nose to the best of your ability. All that stuff still applies. And, the benefit is that oftentimes it does prevent you from getting sick as often, because you are using the tools to filter the air in the way that we hope that we would. And the nitric oxide that we naturally produce kills some of the viruses and bacteria and things. And so, even the virus that causes COVID, they are trying to figure out how to synthetically make it to use it to fight the virus. But we all produce it in our sinuses, and all we have to do is actually breathe through our nose. So interestingly, a lot of the people that were most severely affected by COVID were those who are mouth breathing, who are breathing dysfunctionally, who have sleep apnea and have some of these other issues going on too.
Wow, that's interesting. I've heard that methodology of putting there's an iodine spray up your nose to kind of clear it out, bring immune support there. And again, not making any claims, just to cover my butt, everybody's butt, obviously. I know you're a doctor, but it's interesting that something such as simple as that can affect, again, the immune health, support immune health, affect it, and affect everything else, obviously.
Yeah, I can't speak. I'll just say I can't speak to that. I've never heard of that. I definitely do have used myself the Xclear nasal spray, which is the xylitol, and certainly have used it in my children. We all use it as a family. So that I can speak to, but the other.
Okay. Yeah, no worries. I completely understand. And like I mentioned to you before we came on, I sent you some screenshots to people's questions. Want to make sure we covered those from the sleep apnea perspective. We've been definitely covering the breathing perspective quite a bit, obviously, but the sleep apnea.
Sure.
You would know, how would someone know if they have it? I guess you'd have to get tested. Like, what's the methodology for that?
Yeah. So sleep apnea. So what I say is that snoring is more than noise, right? Snoring is never normal. It's the first sign that there's an obstruction in the airway of some sort. And some people are just snoring. And we're not talking about when you're sick and you're congested and you're snoring. Or if you've had a couple too many drinks one night and you're snoring. We're not necessarily talking about that, although alcohol can affect your breathing at night because it relaxes the muscles even more. So someone prone to snoring or sleep apnea is going to have see more effects when they have had alcohol. But so we have a spectrum of sleep disorder breathing. So it starts with snoring and it goes all the way up to sleep apnea, where you actually stop breathing while you're sleeping. And sometimes people are doing that every couple minutes throughout the night. So it's crazy to think that they're either not breathing or struggling to breathe every couple minutes throughout the night for some of them, or it varies depending on what their score is, but that's a whole conversation. So the only way that we can truly know, sometimes people will see people stop breathing and then gasp for air as they wake up. And that was my grandpa. And that is why I was so interested in sleep apnea and did research in college. But we didn't know as much of it back then, 20 years ago. So now, we want to make sure if I am seeing someone to help them be able to breathe by designing a mandibular advancement appliance to keep their jaw from falling back, I need to know, is their snoring just snoring, or is there snoring because of sleep apnea, where they're actually stopping breathing? And I can't tell by looking at them, by, even hearing their snoring or whatever. They need to have their sleep evaluated. And so that can be a hospital test where they get hooked up and have the polysomnogram, or it can be nowadays they're getting better and better with their home tests that to reveal whether or not they have sleep apnea. And that's diagnosed by a sleep physician. That's not something that I can diagnose as a dentist. I can see the signs and symptoms and I can treat in various ways, but I can't diagnose it.
And you mentioned the device and mandibular. Is TMJ related to that?
A lot of people do also have TMJ issues. So
Okay.
our jaw joint, sometimes if we're constantly, a lot of times we'll see grinding as a side effect of trying to open up the airway. So sometimes as people are sleeping, they try to move the jaw forward to be able to breathe and the teeth get in the way. So we'll see broken teeth, chipped teeth. Sometimes we see the clenching and the grinding. Sometimes we see issues with the jaw joint hurting because they're moving their jaw in certain ways. So sometimes when we treat the ability for them to be able to breathe, the jaw also gets better. Because if you're not getting to sleep as much, pain's going to be more intense too. You're going to notice the pain more.
Right, that makes sense. It's so as you said, from a sleep apnea perspective, it would have to be tested in the hospital, where there's at-home tests, I believe, as well, like you and I discussed.
Yep, we talked about that. Yep.
Some of them are a watch. You can just have it on your wrist or finger, something like that.
Some of them are just a ring. There's one that goes right on your finger. It all just depends, but there's a lot of options nowadays to test, at least initially, in your own home.
That's not intimidating, but it's less overwhelming than having to be in a hospital hooked up and so forth.
Yeah, you feel like it's this pressure to have the right night of sleep, right? That perfect night.
Yeah. How can you do that? And it's harder to do that in that setting. No offense to the hospital, but it's not in your comfortable homely setting in a sense. So it is good to have those options available. And what kind of work do you do? I know you do inpatient work in person, obviously. But what kind of work do you do remotely from a coaching perspective, from a breathing perspective? How do you help people as well with that?
Yeah, so a lot of the times I set up group classes. So I just before starting this with you, set up a group class to be on Tuesday, January 3rd at 6:30 Eastern Standard Time. And so in that class, I'll have an hour of my time. We will go through breathing exercises, and it's called Just Breathe. I called it Just Breathe. And it's really just meant to help with the stress side of things, right? So some ways to teach yourself some simple exercises to do to train yourself to breathe this way, to have those in your pocket so that you can pull them out when you need them. And the exciting thing is you have 22,000 opportunities to practice because we're breathing all day, every day. So why not be on a car ride and start to do some small breath holds or, things like that, even tongue pops to train yourself. There's some really simple things that you can do
What does a tongue pop do?
So that's one of the things for, especially in kids, it helps them to learn to get that tongue up to the right position because your tongue, I don't have any stickers on this one, but so here's the top, here's the roof of your mouth. And we want your tongue to be not just touching this little spot right behind your teeth. We don't just want the tip there.
Okay.
We want you to try to suction as much of it up there as you can. All the way up here, all the way up here. So more of like a clucking.
Okay.
And so teaching kids or adults to learn to suction it up there, even hold it for 3 seconds before doing that clucking sound can get used to having that in that correct posture. And some people literally can't do it because they have a tongue tie, but it's a skill that can be taught and learned, and like physical therapy for the mouth again, or the airway. So we can do it. Easy access to it. It's always with us. We can practice those. I kind of joke around with my niece and nephew. My niece is 2. And again, I just pop my tongue. I do not know what the purpose of it is, but now I know more of like what it is. It's fun too, right?
Of course.
Yeah, but it's definitely one that you can get used to. Mm-hmm.
She and I will do it back and forth, and I'll pop my tongue, and she'll do it, and it's kind of fun. But there is an actual purpose for it, obviously, which is pretty neat as well to hear. And that affects your tongue placement, breathing, and so forth. Correct?
Yes. So
Okay, cool.
tongue placement, also being able, there we could talk about the swallowing position, chewing.
Okay.
There's so much that goes into the myofunctional therapy part of things, which is kind of a non-surgical approach to trying to get that airway healthier as well. So you can't cure sleep apnea per se, but you can do things to help improve. And so if you're, for example, if you're breathing through your mouth all night, if you can imagine a tube that has a lot of air rushing through it really quickly, and if that tube is prone to collapsing, it's going to be much more likely to collapse if there's fast air that's zooming through there and kind of sucking through. But if it's a gentler, slower flow of air, which is often the difference between breathing through our nose and breathing through our mouth, then that collapsible tube, which is your airway, is going to be less likely to collapse. If that makes sense.
That's good to know. And when I met with you, again, it's something that we do every day. We breathe. We don't really think about it consciously. We should be breathing, obviously, but it does have a big effect on us, the method of breathing and so forth, like we're mentioning.
Yeah.
And Shaya Vartakovskaya, can sleep apnea be reversed? So you kind of just mentioned that. Again, like you mentioned, there are ways to support it.
Yes. And so, depending on what's done, there's also, there's lots of solutions, which people don't realize a lot of times for sleep apnea. So there's CPAP, or positive airway pressure, which is basically like a vacuum backwards. It pushes air through, which is going to pop the airway open so that you can breathe no matter what. And that's what this is considered the gold standard. There's holding your jaw forward, or at least keeping your jaw from falling back so that it doesn't close off the airway, in a dental type of appliance, mandibular advancement device that helps treat it. There's also the option to expand the airway, especially in children. Some people need to have their tonsils and adenoids removed. Now, if we can start breathing through our nose and shrink those instead, even better. But sometimes it does need to be done, and then learn how to breathe through the nose. There's ways to expand even the palate, even in adults nowadays, we know. So sometimes, or jaw surgery to move the jaw forward. It all depends. Everyone's a snowflake. So it depends on what's causing it, what's needed. And sometimes the corrections that we do can treat it, not necessarily cure, but can certainly make it better.
There's not a one size fits all by any means. It's all individualized, because we're all individual. Again, like Brittany and I, when working with clients, it's all based on the client when it comes to nutrition, what to eat, and supplements and so forth. Like you, it's always a personalized approach, because it's one thing is not going to be the same as for the other, obviously.
For sure.
Looks like Shaya also mentioned, is there a reason for burning? I'm not sure the context of that. Do you have any
burning? I'm not sure what that's in reference to.
Yeah, I don't know the context. As we wrap up, what are like 3 simple things we can do on a daily basis? Again, we're breathing. So, that's important, obviously.
Yeah. So number 1, you're going to hear me say, tongue up, lips together, teeth apart, breathe through your nose. You can say that to yourself all the time. So especially if the tongue is up in the correct position, some people tell me that they clench and grind all day. If your tongue is up there and it's actually suctioned up there, it's really hard to clench at the same time. You kind of have to choose between the muscles. So keeping those teeth apart. The second thing that you can do is breathe through your nose at all times.
Cool.
Gosh, it's so hard to break it down to 3 things.
It can be 1 or 2, and 100 is a lot. So we don't want to be overwhelming, obviously, but I just want to, some of the things we can incorporate into our day, obviously. Yeah.
And then simple things that you can incorporate into your day, checking in with your breathing, seeing how you're doing it. We didn't go through it, but you can certainly start to pay attention to how many seconds you're taking a breath in and how many seconds you're taking a breath out. Depending on what book you read, James Nestor says the ideal breath or pace of that is 5.5 seconds. But whatever works for you. Some people are going to start at 3 seconds. Maybe it's 4. Maybe it's just a couple, because maybe you're struggling to be able to breathe that slowly. And there's always hope. You got to start somewhere. But it's cadence breathing. So kind of checking in and going, okay, well, let's see if I can breathe in and, breathe out a little more slowly. There's always so much more that I could teach you. But I also always love to tell people to look for the blessings, and I promise you'll see them, and bring some humor to your life. I always say,
absolutely.
Don't forget to smile.
I appreciate your post there.
Yep. Yeah.
It looks like
Save on
there's
life.
Amy Lynn. Sorry to cut you off. She said, my kids and I, she put it out there. So her kids and I have sleep apnea with CPAP machines. Is that for kids? Obviously, there's always hope to support, to make things better in a sense, so they don't have to do that. So anything to speak on from that, would you be able to someone that she could contact in a sense to support that?
Oh, yeah, that's hard to say who she'd be able to contact without knowing where she's coming from. But I would say
Okay.
that she could certainly, on my website, Sleep Wellness Wilmington, there's a space where there's recommended products, and it talks about all the books that I love. And so
Okay.
I love Breath by James Nestor for adults especially, but I also love a lot of books by Patrick McEwen, who's I trained under. But if we're talking about kids, there's some books called Gas, which was written by two dentists. There's a book called Jaws, and both of those sort of talk about how we're growing smaller jaws to begin with, and how we can, different options for treating those things. So many good books. I love books. There's the 8-Hour Sleep Paradox that talks about, again, written by another dentist, and in adults especially, talks about different options for helping advocate for yourself for treating that sleep apnea. Now in kids, we want to make sure they're breathing. And if they're not breathing while they're sleeping, that's going to affect their brain, and it's irreversible.
Of course.
And so we need to make sure that they're getting the air while they're breathing. And so CPAP, if we need it, is great. And we know that having that mask on is going to restrict the growth of their face in that area even more than we're already having that happen just due to evolution and epigenetics. So sometimes in children, there might be the option to do some palatal expansion, to place a dental device, removable or, fixed or whatever, that could then open up the jaw and the nose and make it easier for them to breathe. Maybe they need to have their tonsils removed. Like we said, if they could shrink, great. But sometimes they're so big that these kids literally just can't breathe, and they need a chance to reset. So I think it's a team approach. I think it's her probably educating herself a little bit on what's going on and figuring out. There's probably going on social media, I would say. Airway Health Solutions might be one that she could look into and see if there's a dentist that she could find in her area. I think Ask the Dentist might also have a resource. There's a bunch of resources out there. Maybe the Breath Institute might have some resources of dentists in various areas that she could reach out to. And then working with whoever's handling that sleep apnea as well. It's awesome. Not easy. Never one answer.
God, of course. There's no one answer fits all. So like you were mentioning, you have a program just created January 3rd, I believe it is, in the evening, Eastern time, of course, wherever anyone is in the country, in the world. And how can people contact you? How can people reach out to you and so forth to hear more about what you do? You do offer one-on-one coaching, correct? Or group coaching?
Yeah.
Cool. Awesome.
So easy ways to get a hold of me. So there's Casey. So I'm Dr. Casey Jones on social media, and that is at DrCaseyJones. So on Instagram and Facebook in that way. You can also, again, super easy email. You can send it to Casey, CASEY at drcaseyjones.com, which is DrCaseyJones.com. You can go on my website, which is www.sleepwellnesswilmington.com. There are some ways to get a hold of me through there. And you can also sign up. I'll share the link with you. I created a special price for all the listeners as well. It's just $29 to have this session, which will hopefully bring so much more value for people to take with them after that time that I've spent with them. And so, I hope that helps.
Absolutely. I just have one quick question I've been thinking about.
Yeah.
And over the past couple of years with COVID and everything else, breathing properly and so forth is important. And we think of oxygen. People want to make sure their oxygen, they don't get into, I forget the state, part of the body where you just lack of oxygen. Obviously, if you're breathing through your nose, your mouth, do you get less or more oxygen? Like, could you have a lower oxygen reading with one versus the other?
So interestingly, it's not usually the lack of oxygen that's the drive to breathe. It's usually the buildup of carbon dioxide or the carbon dioxide that's driving it, right? And so
Gotcha.
if we, so I'm sorry, it's actually what we want is, let me explain it this way. So your blood is holding on to your oxygen, right? Your red blood cells, and it's traveling throughout the body to the tissues that it wants to take that oxygen to be able to use.
Right.
Now, in order for those red blood cells to actually let go of the oxygen, it has to be replaced by carbon dioxide. So in people who are breathing through their mouth, they tend to breathe off more carbon dioxide than someone that would be breathing through their nose. And so oftentimes there's less carbon dioxide available for that actual gas exchange to occur. So if someone puts a pulse oximeter on their finger, it may read 100% of the oxygenation no matter what, but whether or not we're actually using all of that oxygen that we're carrying and breathing efficiently is more of the issue than, you know, lack of oxygen from breathing through their nose. So sometimes people feel like they're suffocating, and that's real. I would never, it's breathing. If you're ever uncomfortable, yeah, just stop. You breathe through your nose, you're always in control, right? But a lot of times it's our body tricking us into feeling, and those same people were often the ones that when we were wearing masks, felt a little bit more suffocated because the carbon dioxide that was building up in there was making them feel more of that anxious feeling because they aren't very tolerant to it. And that's all stuff that goes into the training that I do and things to learn to become more tolerant of the changes, I guess you would say.
Awesome, thank you. I was curious about that because we always, if someone has it, they're just saying, no, make sure your pulse ox is at a good range. So I was kind of curious about that. But that's good to know that there's more to it than just the oxygen and so forth, obviously. The question before we go, the question of burning was actually burping. Is burping normal? So I'm not sure if there's
normal.
an exact answer to that either.
Yeah, so that's an interesting question because I don't think it's abnormal, but sometimes if someone is, so the more and more I learn, the more I'm like, oh, wow, I've been doing that wrong my whole life, you know? So even learning the myofunctional therapy and learning about chewing and all of that, I learned that I was not chewing my food enough and not getting it ready, which affects everything down the line, but also, you know, how you're chewing it and how the muscles work and how the swallow works. So sometimes you're swallowing more air as you're swallowing because there's better ways to do the proper swallow than others. But if you're tongue tied, if there's other things that are going on to compensate and you're not swallowing correctly, then you might be swallowing more air, or you might be drinking more water as you're eating food. And then that can cause stomach discomfort because you're more full and you're not digesting and all those things. So you might have more air coming into the system to be moving more, I suppose, depending on what's going on. But I wouldn't say it's abnormal.
Okay, it's just it came up, so I wanted to make sure it's covered. Thank you so much for being on here. Your wealth of knowledge and your energy is amazing. So from both perspectives, very important. It's really good. So good having you on.
Thank you so much. It's been such a pleasure, and I'm just honored that you asked me. So thank you for that.
Absolutely. So what I'll do is I'll put, if you can text or send me a message on Facebook, any links to put in the chat, and I can have so people can contact you and so forth, and know where to access your information and all. So I can definitely do that.
Absolutely. Sounds fantastic. Thank you so much.
Awesome. Thank you again. It was excellent.
All right. Well, thank you. Like I always say, have a great day, and don't forget to smile and dance. Look for the blessings, and I promise you'll see them. Thank you so much.
Have a great weekend, everybody.
Thank you. Bye-bye.